Namaste. Sindagi Shantavireshwara Ayurvedic Medical College and Hospital with Department of Panchakarma welcomes you for the beautiful presentation presented by Shivakeerti B.Malali with the topic Saagni Sweda under the guidance of Dr. Sangamesh Doddagoudasa. Knowing the introduction, as we know, Svedana Karma is the next important and essential Purva Karma after Snehana. It is also important Pradhana Karma for many of the diseases too. Acharya Charaka has mentioned Svedana Karma under Shadupakrama. Svedana is a prime modality of treatment for number of disorders, especially Vata and Kapha predominant diseases. Acharya Charaka has mentioned that Svedana therapy is the best treatment for vitiated Vata and Kapha predominant diseases. Svedana is done to liquefy the vitiated dosha which are spread throughout the body. As a result of application of Svedana, the vitiated dosha are made easily expelled out with the help of Pradhana Karma such as Vamana, Virechana and Basti. Svedana is defined as Stamba Gaurava Shitagnam Svedanam Svedakarakam means Svedana is a procedure which relieves stiffness, heaviness, coldness of the body and produces sweating. Knowing its importance, Shushkanapihi Kastani Sneha Sveda Papadanahi Nyamnati Yatam Nyayam Kin Punarjeevitam Naran means by application of oil and then sudation therapy, the dry stick becomes soft and elastic. Then what will be its effect in a live human being? Let's know the classification. First is Dvandvaja Sweda. On the basis of uses of Agni, Saagni and Niragni. On the basis of properties of the drugs used, Snigdha Sweda and Ruksha Sweda. On the basis of site of application, Ekanga Sweda and Sarvanga Sweda. Coming to my topic, that is Saagni Sweda. Charaka has mentioned 13 different types of Saagni Sweda in Sutrasthana 14th chapter. Those are Shankara Prastara Nadi Parisheko Avagahanam Jentako Ashmaganaha Karsho Kuti Buhu Kumbakaivacha Kupo Holaka Ityarte Svedayanti Trayodashaha. The first described is Shankara Sweda. The hot drugs are made into pottery form and then Svedana is done by direct contact to the body of the patient. It is of two types, Snigdha Sweda and Ruksha Sweda. Here comes a Shastikashali Pinda Sweda, which is a type of Snigdha Shankara Sweda. Here you can see the ingredients which are used in the procedure. Here are the images of the procedure. These are the Purva Karma, Pradhana and Paschat Karma mentioned. Contraindications and indications for Shankara Sweda. Benefits are relieves stiffness and pain, improves circulation, reduces Vata and Kapha, enhances mobility of the joints. Next, Prastara Sweda. In this Sweda, a stone slab of size of human over which the boiled Shukadanya is spread evenly and covered it with a silk cloth, Erandapatra or Arkapatra over the hot Shukadanya. Then the patient who has ointed with oil has to sleep and take the procedure. Here is a construction of Prastara Sweda and indication mentioned are Prushtashula, Parshvashula, Shronishula, Gritrasi and so on. Nadi Sweda. Nadi Sweda is a type of Svedana where a medicated steam is directed through a tube called Nadi through a specific part of a body. It is a localized fermentation therapy where steam generated from the herbal decoctions is passed through a pipe over a body. Here is a setup of Nadi Sweda. Materials used are stove, rubber tube, herbal decoctions and herbs like Nirgundi, Eranda, Dashamola and so on. And Purva Karma, Pradhana and Paschat Karma mentioned. Indications are joint pain, muscle stiffness, cervical and lumbar spondylosis, sciatica, and so on. Next come Parisheka Sweda. Parisheka is a procedure of pouring of warm herbal decoctions, oils, milk over a body to induce sweating and relieve the disease. Type of Parisheka are Sarvanga Parisheka and Ekanga Parisheka. Liquids are Kvata, Taila, Kshira and Takra. Benefits are relieves pain and stiffness, improves blood circulation, reduces muscle tension and so on. Knowing the procedure, patient is made to lie comfortably on a droni. Warm medicated liquid is poured continuously from the height. Temperature is maintained throughout the procedure, done for 13 to 45 minutes, followed by gentle wiping and resting. And next comes indications and contraindications. It is indicated in Vata disorders, muscle spasm, paralysis, back pain and arthritis. And here is a procedure images how it is done. Next comes Avagaha Sweda. Avagaha Sweda is a type in which a body or a specific part is immersed in a warm medicated liquid. It is of two types, Sarvanga Avagaha and Ekanga Avagaha. Sarvanga Avagaha means full body is immersed, where Ekanga means partial immersion of the body part. Materials used are tube or a vessel, vata, taila, kshira and heating arrangement to maintain temperature of. Knowing the procedure, patient is asked to sit or lie in a tub filled with a warm medicated liquid. Level of the liquid depends on the diseases. Temperature is maintained comfortably as per the warmness tolerance. Duration 20 to 30 minutes. After procedure, body is wiped and patient is rested. Indications are anorectal disorders, urinary disorders, gynecological condition, lower back pain and so on. Here is a setup of the procedure. Next comes Jentaka Sweda. It is a type of Svedana where the patient is exposed to heat inside a specifically constructed closed chamber. Construction goes like this. A sudatorium of above said dimension is to be constructed. Vatashamaka drugs should be pasted and smeared to the walls. Then benches should be placed at the height of 1 hasta above the wall. The Angaraka Kostaka Stamba is placed at the center of the room. Then the woods are filled into it and burned, covered with a lid. Then the coals become free from the smoke and it is ready for the Svedana procedure. Here is a diagrammatical presentation of the procedure. Next is Ashmagana Sweda, means it is a type where the patient is made to lie or sit on a heated stone slab and heat is implemented over the body. Here is the procedure picture you can see. Indications are Vata disorders, low back pain, muscle spasm, joint disorders and so on. Next comes Karshu. A circular pit is made such that the upper part should be narrow and the lower part wide. Then the Kostagni are filled into the pit. Then the fire becomes non-smoky and a cot having the size of human being is placed to the mouth of the pit, covered with a slab with a silk cloth. Then the patient has to be ointed with the oil and should sleep over the slab, covering his body with a blanket till he gets Svedana. Here you can see the construction and indications like Vata disorders, lower backache, obesity, body ache and rigidity and some of the musculoskeletal disorders. Next comes Kuti. For this Sweda, a circular, neither big nor too small kuti is made. The inner walls are pasted with kusta and etc. drugs and aromatic drugs. The kuti should be devoid of window. The cot should be with a blanket kept at the center of the cabin. Keep 4 groups of Nirduma Angara Kostagni at the around the cot. Then the patient has to sit in the middle. Here is a construction and indications mentioned. Vata disorders, chronic body ache, neuromuscular conditions, obesity. Next type is Sweda. The procedure is same as Ashmagana Sweda except here in the place of stone swab the earth is dig out. Kumbhi Sweda. A pot filled with a Vatahara Kashaya is taken and buried in the earth up to the level of neck of the pot. A cord should be placed over the pot and the patient should be ointed with the oil, should lie over it and cover his body with a blanket. Here is a construction model of the Sweda as shown in the diagram. Next comes Holaka Sweda. A long tank measuring about 6 into 2 feet is made and kept on a earth's surface. Then fill the tank with the Prani Purisha and burn it. When it becomes free from the smoke, a cot is kept over the tank. Patient who has been ointed with the oil should lie on it and cover his body with a blanket till the appearance of proper symptoms of Svedana. Here is a construction model of this procedure. Here comes the last type of Sweda, that is Kupa Sweda. Long pits of size 6 into 2 feet is made and then fill the pit with a Prani Purisha and burn it. When the smoke stops, a cot is kept over the tank. Patient who has been ointed with the oil should lie on it and cover his body with a blanket till the appearance of proper symptoms of Svedana. Here is a model which shows the construction of this procedure. Indications are Vata disorders, chronic musculoskeletal disorders, obesity, lower backache and kapha related disorders. Here I wind up my presentation. Thank you for your patience listening.